Do you feel like there is a hidden truth to succeed in your nursing exams, or you feel like you're studying a lot and it's really not reflecting on how much you're actually studying? You're still getting those average grades? Well, I'm here to tell you there is a simple thing that you guys are missing, and it is how to decode an NCLEX style question. So in this video, I'm going to show you the strategies that we share with our nursing students inside the Coursera platform that significantly increases their grades. Really what this is we're showing students how to create a strategic process when they go through every single one of their nursing exam questions, and it increases their chances of answering it correctly every single time. Now, I truly believe this is probably one of the most important tactics that you can have in nursing school because, as you probably already know, you can know every single little thing that could be on that exam and you could still do poorly because of those nursing style questions, as you know, are very complex and they persuade you quite a bit. So I'm going to show you the unbeatable process in that. And the first step is knowing the anatomy of a question. So we talk about the anatomy of a body. Well, there's an anatomy of a NCLEX style question. There are 4 categories. Number 1 is the question. So what is the question actually truly asking? And then number 2 is the context. Now, this is where people get stumped up immediately, is because they don't really understand the difference between context of a question and then the actual question. So we'll get into that. And then there's also a key term in every single question. And then you want to know about the answer options. All right, so that is your 4 anatomy points of a NCLEX style question. So in this video, we're going to show you a direct example of a question. We're going to use this question to go through all the steps of how you decode an NCLEX style question. All right, so the question is, a patient with heart failure and diabetes is prescribed furosemide, so Lasix, for diuresis. Which nursing intervention should the nurse implement when administering? Select all to apply. Those dreadful select all to apply questions. So let's go into the anatomy of this question here. So let's read it once again. A patient with heart failure and diabetes is prescribed furosemide / Lasix for diuresis. Which nursing intervention should the nurse implement when administering? All right, so let's find the question. All right, so step number 1, we want to find the question without considering context. So guys, context is your enemy. Context is persuading you to think a certain way or to answer the question a certain way. So we want to find the question without any bias of what the context is. You will find, guys, that a lot of the times, these questions they give you, you could probably answer the question without even considering context. Now, some questions, of course, context is key. You have to understand the context. The context is required to answer it. But here's an example of what I'm talking about here. Where is the question in this question? So what specifically is this question asking you? We want to find that out. That's step number 1. All right. So the question is, which nursing interventions should the nurse implement when administering furosemide? All right. That is your question. All right. So step number 2 with this process is finding the context. Okay. So this is why we do question first and then context. If we consider the context, we're only thinking about the context now. And really the context is just additional information rather than just your question. So the question is number 1. You always want to consider question first and then deeply understand it. And then you add your context in with the understanding of what the question is. Because if you consider the context first, then you're running into an issue where you could get persuaded by it. All right, so where is the context in this question? All right, so we know that the question is, what nursing intervention should that nurse implement when they administer furosemide? So where's the context? Okay, the context is we have a patient with heart failure, number 1, and diabetes. That is your context. And what's the purpose of the Lasix? It's to diurese, which, you know, that's the mechanism of action for furosemide. It's a diuretic. It's going to help diurese the patient. All right, but our context here is heart failure and diabetes. All right, so keep that down. So write that down here. But how do you actually know what is context? Well, context is just simply part of the nursing process. So if you guys remember from your fundamentals of nursing class, the nursing process is anything that has to do with assessment, diagnosis, planning, interventions, and evaluation. Specifically, of course, diagnosis, you allow your medical history. Evaluation, a lot of times they reflect what kind of medications you're giving. But the question you want to ask yourself with every single question you have, does the context impact my question? Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. All right? Because if you ask yourself that, it's roadblocking the ability for the context to persuade you to think a certain way. So once again, guys, Step number 1 is always find the question without considering context, and then you add in your context second. So we're understanding that this question is asking us what intervention should we do when we give Lasix, okay? And then the context is, okay, we have a patient with heart failure and diabetes. That's our context. Step number 3, find a key term. Most NCLEX style questions have key terms. What does that even mean? Well, for example, if you have a prioritization type question, you're going to find a key term is that there is first or next or most. That's asking you what should be the priority. Okay, that's your key term. What step 3 is essentially doing for you is a double check on what the question actually is. Okay, so we're double checking here, making sure that we understand the question completely. Now, can you guys find the key term for this question? Well, I would say interventions is a key term because what action should the nurse do when they administer furosemide? So the key term here would be interventions because what is it asking? It's asking about interventions. That's your key term. So before we even go into the answer options, we're understanding these 3 steps. Step number 1, once again, find the question without considering context. What's our question? Which nursing intervention should the nurse implement when administering furosemide? Okay, that's our question. What's the context? Well, we have a patient with heart failure and diabetes, okay? And our key term here is intervention. So our answer options, when we go through them, before we even look at them, we need to know that we're looking for answer options that reflect on interventions or giving furosemide, okay? Why am I not considering the context? Because that's not really part of the question. The question is asking me, what should I do when I give furosemide? The heart failure and diabetes stuff is just additional information that isn't actually part of my question. Okay, so step number 4, go through the answer options individually. Do not fall into the trap of comparing your answer options and seeing which one's better than the other. You guys need to go through a systemic process of going through your answer options individually and looking at it one by one and asking yourself, is it correct? Now, a little test taking tip that I like to give my students is try to answer the question without even looking at your answer options yet. If you answer the question, you're most likely going to find that answer option that's most reflective of your answer. Okay, so let's go through these answer options individually. Now, a select all apply question specifically should be treated like a true or false question with each answer option. So our answer options here are A, monitor serum potassium levels regularly. Now, like I said, I'm not going to jump ahead and start looking at my other ones. Now, let's answer this question. Should we monitor serum potassium levels regularly? Well, if you guys know the context of Lasix, it's a diuretic that spills potassium. So yes, that answer is true. We should monitor serum potassium levels regularly. So we're going to select that one as correct. Now remember, this is a select all apply question, so there's going to probably be more than one correct answer. Let's go to B. Administer medication slow, IV push. All right, so if we know about furosemide, that we should give this medication slow because if we give it fast, it could cause something called ototoxicity and, of course, drop the blood pressure too quick. All right, so this answer is correct. Now, a little test-taking tip once again for you guys, or a concept tip, you should say. There is not very many medications that are IV push that should be given fast. Now, the exception of that is adenosine. You want to give that medication fast. Now, most of the time when there's a medication that says administer fast or it doesn't say administer slow, then it's most likely incorrect. But furosemide especially, we want to give that slow IV push. C, monitor blood glucose frequently. Now, guys, here is where we need to make the point. Is giving furosemide related to the blood glucose? No, it's not. So this is not a correct answer. Now, here's why context can persuade you. Now, if we go back to our context of the question, we have a patient with heart failure and diabetes. Okay, should we monitor blood glucose frequently with a diabetic patient? Yeah, we should. But is that what the question's asking you? It's actually not. So this is why we go through these processes when we go through a question, because we are not allowing context to persuade us. C is an incorrect answer here because it is not related to furosemide administration. So that is why we commonly get stumped up on our nursing questions, is because we're allowing context to persuade us to think a certain way. All right, so C is not a correct answer. So moving on. D, educate about the risk of orthostatic hypotension. So furosemide, what intervention should we do when we give it? Okay, well, furosemide can drop the blood pressure. It dehydrates people. And what's a risk factor for orthostatic hypotension? It's dehydration. So this is a correct answer. And then lastly, monitor blood pressure regularly. Well, if we're at risk for orthostatic hypotension, then we're at the same thing. This is pretty much the same type of answer. We want to monitor the blood pressure regularly when we're giving furosemide. So this is also a correct answer. All right, guys, so what we just showed you, if you guys write all these steps down and you really practice, so the key term is practice. You guys need to practice a lot of practice NCLEX style questions before every single exam, especially reflecting on the content that's going to be on that exam. So that way you can practice your ability to do the processes that we just went over. So this is not something that you can just pick up and just start doing. This does require practice. I want you guys to use these steps and create that systematic process that we just went over. And you'll find out that if you have a standardized way that you go through every single question, you'll be much better off with your nursing exam scores. Now, to end this video, we're going to go over the rules of test taking because it's going to reflect what we just went over, but let's just make it very clear for you. Number one, never read your answer options before understanding the question. That's a common thing that we see with nursing students is that they're reading their answer options before they even understand the question. Why should you not do that? Because it's going to persuade you on how you actually understand the question. Number two, do not ever read the context into your question. Find your question inside the entire case scenario and single it out without considering context first. And we just said this, but this is a rule of test taking. Practice, practice, practice. Practice makes perfect, especially with these NCLEX style questions. Like we said earlier, you can know everything about the test, what's going to be on it, and you could still do poorly just because you're not doing enough practice questions. How many you might ask? Well, we have 5 segments of studying inside our Coursera platform for our nursing students. We segment it out by note taking, note reviewing. Number 3 is practice questions. Why is it number 3? Because we do practice questions right after we understand a concept, because there's a skill of understanding and then there's a skill of applying. Doing practice questions allows you to apply that knowledge into complex nursing scenarios. So we do practice questions, number 3, with our studying. And then number 4 is active recall. So using a whiteboard or using flashcards, you're independently thinking. So this is also helpful when we went back to answering questions before you even look at your answer options. This is going to increasingly strengthen your skill to answer these correctly. And then number 5 is our practice exam section, where we do 2 to 3 practice exams that are going to be exactly like the exam coming up. So if you have a 50 question exam over fluid and electrolytes coming up, then we want you to take 2 to 3 50 question practice exams that are going to be just like your exam coming up. And not only do we do the practice exams, we also mimic the environment. So we want you to have an uninterrupted practice exam that is just like how you're going to take it on exam date. And then lastly, guys, I want you guys to show up early for your exam. So show up at least 15 minutes before your exam starts. So that way you can sit in your chair. You want to allow your body to get used to the environment and be calm before you even get to your exam, because it's going to help clear your mind up and you're going to reduce your chances of having brain fog during your exam. Now, if you guys didn't know, we have a lot of free resources for nursing students on our website on tactilevr.com. It's also in the link in the description below. We have lots of note templates such as a pathophysiology concept map. We have a pharmacology concept map. We have study guides such as fluid and electrolytes, EKG worksheet, cranial nerve worksheet. We are really wanting to make sure that you are successful in nursing school, but if you're ever needing any additional help, you guys can become a member on the Coursera platform, where you have nursing educators giving you live sessions constantly, and you have a huge platform with 1,700 plus pages of study guides, and then you have 1,000 plus practice questions, and then you'll additionally get a virtual reality clinical game that allows you to practice your skills on demand from a virtual reality headset. Our nursing educators will help you with lecture, your lab skill checkoffs, and your clinical rotations, and answer any questions that you have, and you'll join the nursing community board where you can get your questions answered at any time by experienced nursing educators. I hope this helped you guys understand a systematic process to answer your NCLEX style questions and improve your nursing exam scores. Thank you guys for watching. We'll see you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.